Dental disease is the #1 disease in cats and dogs, which is why a dental procedure under general anesthesia is an essential part of the routine annual care in our pet's health. The first thing to know is that dental disease happens below the gums. When a dog is awake, I can only tell you about the surface of the crown and the gingiva, but 60% of the tooth is below the gums. And a non-anesthetic dental will tell you nothing about that 60%. Only full mouth x-rays or CT scan will show you that 60%. Just because the teeth look fine, it does not mean that they are perfectly fine underneath. In this human model, there's tartar on the crown of the tooth, but there's also tartar below the gum line. That's the tartar to be worried about because it's what's causing gingivitis and pain. So doing a non-anesthetic dentistry is purely cosmetic. It's only going to get the tartar above the gum line. That's not going to have any effect on your pet's health. It's going to give you a false sense of accomplishment. A dentistry under anesthesia is going to be a professional cleaning that scales the tartar above and below the gum line, as seen here. So let's talk about our next very important takeaway. Animals almost never exhibit signs of oral pain. Even when things are horrible, they don't understand complaining, so they keep living their lives, and they act super happy because that's what they do. The gingivitis we talked about will cause gingival recession, and that's where the gums lose their attachment to the bone. They then lose the bone that holds the tooth in place, all of this being chronically painful. And this is yet another critical difference between anesthesia-free dentistry and an anesthetic dental procedure. The technician will check each and every single tooth for anything abnormal. Here's a summary of what our oral exam looks at under general anesthesia, including addressing tooth fractures. And when a tooth fractures, bacteria will migrate through the tooth into the bloodstream. It's very common for dentists and general practitioners to see patients with no obvious signs of oral pain. But after fixing that major problem that is hidden, the pain goes away. Their behavior completely changes. But because the onset of those changes is so gradual, we are not able to appreciate those subtle changes over time until we fix the problem. Finally, I recognize that anesthesia is not 100% risk-free, but it's not as scary as you think, as long as it's done in an appropriate and conscientious manner, taking the individual patient into account. This includes doing a physical exam, blood work, and monitoring all vital parameters during anesthesia. And you can check out the extended version of this video in the link below, where I'll go in depth about anesthesia and the dental procedure, which will include real-life examples and visuals. Thanks for watching.